my name is Shauna Smith and I'm a clinical specialist sonographer working in Hull. I was lucky enough to be granted some funding from the Cancer Alliance to carry out the IOTA Adnex project. As most people will know, ultrasound is usually the first line imaging investigation to diagnose gynecology pathology. The trouble that ultrasound has is that often the imaging features associated with benign lesions and the imaging features associated with malignant lesions often overlap on ultrasound. So there have been lots of softwares in the past that have been developed to try and help to categorise lesions into benign and malignant lesions, one of them being the IOTA itself. So that is a set of imaging features that are seen on ultrasound that can help determine whether something is benign or malignant, but it doesn't help with indeterminate categories, and it also doesn't help to subcategorise into what type of malignancy is present. IOTA then further developed a risk model called Adnex, and this is where our project in Hull came in. So Adnex is a package that can be installed on ultrasound machines, and what it uses is 3 clinical predictors and 6 imaging predictors to help determine whether a lesion is benign or malignant, but then also help to subcategorise into the 4 types of malignant lesions. So that's borderline, stage 1, stage 2 to 4 and metastatic. So instead of doing it as a blanket rollout, we piloted it. We got our sonographers to just perform their normal practice, and then we had one unlucky person or lucky person, whichever way you want to look at it, which was me, who then reviewed all of the imaging that was performed to see if we can use Adnex to help subcategorise the lesions that were found. Adnex was able to confidently categorise 28 of these into benign, malignant and subtype of malignancy as well. So it was really positive from our point of view. Obviously the benefits that we felt to patients and to staff were that Adnex helped us to be more confident when it comes to reporting ovarian lesions, but it also has a massive impact in patients' onward journeys. So when we see a lesion that is benign, we can be confident the lesion is benign, and the patient can be informed, discharged and happy that they've got a benign result. In the cases where the lesions were found to be malignant, because Adnex was able to subcategorise those lesions, what it meant is that we could then be confident in what type of onward imaging the patient might require. So massive benefits to patients because they're not having to go for multiple different imaging tests to determine what's actually going on with them, and also better for pre-surgical staging because it would mean that surgeons could then have a better idea of how to perform the surgery. Overall, it would involve, nobody likes to talk about this, but you have to talk about it, cost savings in terms of not having to have multiple imaging modalities, not having to have multiple MRI examinations, and actually it could overall reduce the number of MRIs that we would have to perform. The key benefits to this Adnex project are obviously improved outcomes for patients, faster patient journeys, so better triage into different services dependent on what the patient needs, and the reduced need for multiple imaging, therefore less hospital appointments overall.